Sean, was that good?
I don't even understand what I read. I don't even know what this is. I stopped reading.
All right. Good afternoon, everyone. I'd like to call this July 13th Jail Oversight Board meeting to order. We'll start with a pledge of allegiance.
Flag of the United States of America, and to the republic for which it stands, one nation, under God, indivisible, with liberty and justice for all.
Thank you. And as always, the first item on our agenda is any public comments, specifically on items that are on the agenda for today. There will also be an opportunity for public comment at the end of the meeting for anything that's Jail Oversight Board related. So are there any comments from the public? All right, hearing none. The next item is an approval of the June minutes. Are there any comments or questions on the minutes? Is there a motion to approve?
I would make a motion.
Thank you, Your Honor. Thanks, Brian. Motion is second. All in favor?
Aye.
Any opposed? Okay, the ayes have it. Next item is an approval of the June Wardens Report. Is there a motion to approve?
Motion to approve it.
Thank you, Judge.
Second.
Thank you, Sheriff. Any questions or comments? All in favor?
Aye.
Any opposed? All right. The next item is an approval of the staffing penalties for June. Warden Tatum.
Good evening, everybody. The penalties for June of this year total $172,551.22. The staffing rate
All right. The next item is an approval of the staffing penalties for June. Warden Tatum. Mr. Tatum, can you give us a little, that seems very high. Can you give us a little context versus the last few months?
This month, if you were to break it down by department, it looks like we had an elevation in the penalties in health services, and continues in correctional services. The number in health services was $172,000 alone for the month of June. Certainly that helped increase the overall number. For security.
I'm sorry. I thought you said the overall number was 172,000.
I'm sorry. I'm correct. You're correct. I meant for the month of June for health services was $20,000. My mistake. So that was a significant increase. Steadily climbing for the last few months.
And what does that actually look like, just in terms of actual people that we need in health services?
We're down 6 positions in health services, 5.9. So, and these, of course, they get penalized. The longer those positions are open after 45 days, the more you get penalized. So all of those positions that are open are in excess of 45 days.
And how does that compare to the last few months? Is 172,000 the highest it's been?
Oh, it's not the highest, but for the month of June. And then as opposed to 95,000 last month.
Any questions from the warden?
I have a question regarding the health services. Are agency health staff permitted to be hired or solicited to come in to fill positions that can't be filled in the normal hiring process?
I'm not sure about what that, I'm not sure about the question.
Sure. So I'm from the acute care hospital world. So when we can't hire or we open a new unit and don't have appropriate people, we go out to a third-party agency that, what's commonly known as traveling nurses, or there are nurses who work for agencies that don't travel as well. So I meant an agency like that, if these are healthcare providers, either RNs or LPNs, are they permitted to be hired to fill these roles?
I don't know the answer to that. I do know that there is a provision for going to contractors.
I think that's the same, yeah, I think that's just a different term for the same thing.
There's a provision for that.
Yeah, 'cause I know in the acute care world during COVID, we've lived with travelers in all of our locations because of, the effects of the pandemic. So I was just curious if it was permissible in this setting as well. Because I would suggest that to be sought after.
I agree with that. It seems that there's resources that are commonly used by, in the industry, they should definitely reach out for that. Different ones, security issues possibly, but definitely in the medical field, that's a common solution.
Yeah, I mean, it's a little more costly, but you still have to go through all the word I'm looking for, all the security checks, as if you were hiring them, at least on the hospital side. So I'm assuming it would be the same in this setting as well.
I will go back and cover that with our health services administrator and see where we are on that.
Okay, thank you.
Any other comments from the board? Warden Tatum, is there any kind of color commentary from GEO about what they're currently intending to do here? Is there anything further that you know that they're...
They're, from what I can see, they're aggressively hiring, not every hire works out. They had, I think in May, there were 25 people terminated. I think last month there were 14 terminated. So sometimes as quick as you get them in, sometimes they're going out, But they are not sitting on it. They are moving toward trying to hire and cover these vacancies.
Has that translated into offering incentives to attract people financially?
I wouldn't know that. I wouldn't know if that is part of.
Okay. Is there a motion to approve the staffing penalty?
Make the motion to approve the staffing penalty.
Second.
Motion is second. Any other questions or comments? All in favor?
Aye.
Any opposed? Right, the ayes have it. The next item is an approval of the MAT program. And Warden, if you'll give us a little bit of context here, and Brian, I'd imagine you may also want to talk about what we're doing here.
All right, so the board presented a formal request
Sounds like something wheeling.
for an amendment to the professional services agreement to add a Suboxone MAT program. And that was sent up. GEO has agreed to the terms of that. They signed it, and it's back here this evening for a vote. Right? So if the members concur with GEO on the conditions of setting forth this program, all we need to do is sign it, and then we go forth with the program. Hopefully it could be in place, I would think, as early as sometime in the middle of August. Some of the parameters would be 30-bed maximum for this particular program, and the staffing plan. In fact, I think that this program or the attachment I'm talking about has already been handed out to all of the members with the staffing plan attached to it, all right, for your consideration during this vote.
Warden, can you speak a little bit to the funding, to our grant?
So the medication part of this is budgeted in the grant at $22,500, and GEO will get that to support the buying the medications. However, in this particular agreement, anything in excess of that grant, GEO would bill the Jail Oversight Board for that on a monthly basis.
But back up a little bit. The overall grant that the county received was how much?
I'm not sure, maybe
Right.
for the entire program.
Yeah,
I'm not
I
sure.
think over a 3-year period it was just don't have the exact number, 1.2 million? Does that sound right?
That sounds right. I'd have to check and get back with you on that. But, you know, there was that. Then there was the allotment for staffing, which was $152,000 under the grant. And GEO, you know, it couldn't do it for less than $195,000, right? And so there's somewhere around $43,000 that has to be taken up. But again, you know, that's not going to be an issue for the first year of the grant because it's so late in the year that you're not going to exceed $22,500 for the medication or $152,000 for staffing. So this is something that can be taken up at a later date.
Okay, so what you're basically saying is because we're only getting a very tail end of the first year, we have a lot for that first year grant, but we only have a stub period that's actually going to be happening, right?
Absolutely, yes.
Okay. Brian is our MAT Subcommittee Chair.
Yeah, thank you, Chairman. So one of the things, kind of just wanted to go through a timeline of this program, because here we are, and I want to thank you, Warden, for bringing that here today. You know, we've been talking about this when this Jail Oversight Board commenced about 18 months ago. One of the first goals was to expand treatment inside George W. Hill and to set people up for success when they're discharging. As we know, in the midst of this opioid epidemic and the amount of individuals that are coming in that have substance use disorders with the primary substance use of opioids, that this was something that was desperately needed. And we had this full-on program. Here we are 18 months later with this finally going into effect, has been a full-on collaboration with so many people. It was, I think, about 3 weeks before the curtain dropped on COVID that we had a scheduled tour for the Department of Corrections to go through SCI Chester to see how they do their MAT program. So we were in conference calls with the Department of Corrections. We were in conference calls with corporate GEO. I want to really say that the Delaware County Office of Behavioral Health, the single county authority, Sandy Garrison, Dana Ratcho, and getting this grant put together and collaborating with Crozier on this. And, you know, I know that for us, talking about this program, you know, we wanted it done immediately. And unfortunately, with different external circumstances, that didn't happen. But through a lot of collaboration with a lot of people, here we are today, and this is something that is desperately needed. And as we talk about initiatives and programs within the jail setting, this is something that, you know, expanding treatment and offering another MAT program is something that is really, really needed here in Delaware County. And to partner with so many people to do this, I definitely want to put out the appreciation of that collaboration. And, you know, in talking to the provider that will go in there and start this program, it sounds like once we can get this signed and sent, that this is something that can realistically start in the next 30 days. So to be sitting here in August of 2021 and to have this program expand, I'm excited about the feedback from that and about ultimately the people that we can help and the precedent that we're setting that George W. Hill, that individuals that get incarcerated in there have an opportunity to work on themselves, to better themselves, and are set up with more success when they leave there. So I thank you for, since being appointed to interim warden, you've really spearheaded this, and I want to thank you for that, and thank everyone on the board for their continued support and advocacy for this program. That's all I got. Thanks.
If I could add, there were a couple people on the GEO side that should be mentioned. Dan O'Donnell in particular, who, you know, we collaborated on this particular request. And John Oliver was consequential in this as well. So I'd just like to throw those out as well.
Any other comments from the board?
Gordon, what was the last name you just said? John?
John Oliver.
For my part, I want to echo the thanks of that Brian listed out. I mean, this really is a major movement forward in the way in which our jail is going to be dealing with the many people who walk through the doors who are dealing with opioids addictions. We know that it's as many as 1 in 4 who enter George W. Hill are dealing with opioids addiction. And while the pilot program, the Vivitrol pilot program that started under the new contract in 2019, was certainly a welcome beginning, a program that only handled 30 at max, and really for most of the time until the last few months was far below that cap. It really was just a beginning. And so by expanding to make buprenorphine available, George W. Hill is actually going out to the forefront. There aren't many jails where buprenorphine is made available, but it's certainly a vital part of the effort in Delaware County to combat the opioids crisis. We know that between 40 and 100 times more likely one is to die of an opioids overdose in the first 6 weeks after leaving prison. And so to be able to provide the most, supportable evidence-based treatment, which is Medication-assisted treatment in combination with other forms of treatment, to be providing that at a time when someone's most vulnerable before they leave the jail, and to be able to transfer them into ongoing treatment on the outside. This really is a critical part of our effort in Delaware County. So I really want to thank you, Warden Tatum, and our Office of Behavioral Health, and everyone who both fought for getting this grant to provide the funding, and then also to get this implemented. So this really is a major step forward for the jail.
I'd just like to add something too. As someone that sat through, I guess, every council meeting since we arrived in 2018, I will say, Councilman Madden, you have brought forth the idea of this kind of program, and it was really not, it wasn't available, and it's really is good to see this coming to fruition of this effort, because you really have, you've brought it up at every meeting that it was possibly on the topic, or could be. So I give credit to everybody for getting the money and behavioral health, but at every council meeting it came up, you have tried to push this forward. So this is really, it is an achievement for the jail and the people running it, and Councilman Madden and the whole board. So, and thanks to Brian Corson too for really spearheading it as well for us. So thank you.
Thanks, Tran. If nothing else, is there a motion to approve this amendment?
I'll make the motion to approve the amendment.
Second.
Motion is second. Any other questions or comments? All in favor?
Aye.
Aye.
Any opposed? All right, the ayes have it. The next item is a coronavirus update.
Yes, infections for June, 111 inmates were tested and only 1 new infection for June. For that, we had no new infection among staff members reported in June, which is the first. A total of 97 new vaccinations were administered to inmates in June. And our Health Services Administrator, back on June 22nd, added another question to our medical intake screening form, which basically identifies individuals coming in who've already had the shot. Prior to that, we weren't really capturing them effectively, but since June 22nd to June 30th, we've identified 50 people coming in the back door who had already been vaccinated. which is significant because that represents 8% of all of the new commitments for June. So had we gone back to the beginning of June, we probably have a different picture, but I look forward to reporting on that in earnest next month.
Warden, how many vaccinations does that now get us up to in terms of administered at the jail?
Well, ones that we administer would be somewhere over 400.
Does that give us a rough sense of the percentage of the population?
We
that's-
were at one point at 39.5%. I want to say that we're probably a couple percentage points below that at this point because of people who've come in and out. But I'll have a better idea of that in the next couple weeks. Right now, they're doing some analysis in health services through Correct Tech.
Yeah, if that's something that we can track. I mean, if we're asking on the way in and we know administration's
Right.
there, that'd be a good thing to
Yeah,
just have a sense
I'm really
for.
looking forward. I think that number is going to be really good next month.
Yeah, and I get inherently it's a challenging population and circumstance to get folks to get vaccinated in. You know, I think there's an inherent distrust when someone's incarcerated. But, you know, I think this is roughly tracking what I've seen statewide and nationally is in that, I mean, 40%'s actually not so bad.
40% is, you know, what I've seen on regularly in most places is somewhere between 25 and 30%.
Yeah.
But, you know, we're also going back at people who had previously declined and saying, what about now? What about now? You know, so we're not giving up on those individuals.
And if I heard you right, one new infection out of 411 tested.
No, 111.
Oh, 111 tested.
111 tested for
Okay.
June and one new infection among them.
Okay, so less than 1% positivity, which is about the same as the overall county average. The county average is about 1%.
We had
today.
a significant number last month. We thought it would swing back this way this month.
Good, good to hear.
If
Well,
I could just make a comment about this. I know the board's aware because I had emailed the group, but for the public, kudos to health services in the month of May. During intake, they discovered that an inmate prior to incarceration had received a first vaccine from Crozier Health and would have missed their 3-week window of their second while at George Hill. So health services contacted us, arranged a date and time. Sheriffs transported the patient or the prisoner, and we were able to administer the second. So the first shot didn't go to waste. So good intake, even though it was in your formal time of June. I think that was great that you allowed that to occur. So
Thank you for that. Health services folks, thankless job in many respects. You know, they do the best they can in challenging circumstances, but, you know, they do, I think, a great job.
Anything else for the warden on COVID? All right, moving on to our deprivatization update.
Good afternoon, members of the Jail Oversight Board and the public. The team's been busy this past month with preparation and response to RFPs on medical, maintenance, food service. The medical RFP has been out on the street for several weeks. The county received 145 questions from a large number of respondents. The answers to all of those questions went back out last Thursday, were posted on the county website. We're pleased that there's a lot of interest in these services. We are also preparing, should the county decide and vote to take back the prison, we're working with the county to look at wage rates, benefits for the staff that will be brought over from GO to the county. You know, recognizing that the difficulty of hiring staff and the low wage rates that they receive now, We're recommending to the county to increase the wage rates for those staff that come from GEO to work for the county, and as well as the benefits will obviously be significantly better as well. So we're putting together budget numbers around that. We'll report back to you on that in the future.
And again, just to take a step back in terms of the overall timing for when we expect these services to be, contracted and here for approval.
We expect to have enough responses from the RFP processes to have some budget numbers to put together, and we'll come back to you in September with a new budget that reflects the findings, as well as we'll reflect probably some work on the future salary rates that we will recommend that you consider.
Questions or comments from the board?
I was just said any increases in salaries, that really was part of the financial feasibility study too. That was built into the projections of what it might be.
There were some projections that were built into the financial feasibility studies that we shared with you in March, but we're going back to take a second look now, given what we've seen at, I think we discussed in the May meeting that Chester County, Montgomery County offer their starting salaries for correctional officers significantly higher than what the correctional officers are offered here in Delaware County. I think there's an obvious relationship between that and the difficulty of hiring correctional officers. We will be recommending to the county to put together a salary schedule that has better pay and better benefits for the future employees that would come over from GEO.
I have a question regarding that, only because it's been in the popular press so much about staffing jails with corrections officers, not only locally but across the country. The recommendations that you're going to make of increased staff, increased salaries and benefits, how does that relate to, say, Philadelphia, who is also going through a staffing crisis? Like, where do you estimate that you're going to plant yourself to not also have the same issues that Philadelphia has now, even though they're at a much higher rate?
Well, it's premature to say where the rates will be, but it's public knowledge that the neighboring counties, including Chester and Montgomery County, are paying close to 40% higher than Delaware County's rates. So it's very hard for Delaware County to compete with that. It needs to be somewhere in the ballpark. It needs to have a competitive wage rate if it's going to be competitive in the job market. It's that simple. And there's certainly everybody's having trouble finding workers, but if you're significantly lower than your neighboring counties, you're going to have a much larger problem, obviously.
Any other questions? And again, I think just to remind the public about the context for these RFPs, the idea was really that we had this feasibility study that was the results of which were brought back earlier this year, and the board voted to move forward with certain discrete services that would allow for us to do really two things. One, to sharpen our pencil more on the financial component. So instead of just the estimates that were provided through the work of CGL, we would actually have in hand real costs. We would have proposals in contract form from the vendors who could then do these services. So it allows for this board to make a more informed decision about the overall contract when we know pretty big chunks of the cost structure, what they would be. And then secondly, just in terms of the execution risk, to be able to take multiple bites at the apple instead of trying to eat the overall apple with one bite.
Exactly.
Is really kind of the idea here.
Much better to phase in services rather than to do it all at once.
All right.
One last thing on the transition, just so people on the board know that there was a meeting held since our last meeting with our IT people and the project manager, looking at this with the people in my department and going through just to understand what the county uses and understand what's being used up at the jail now and how they interrelate. So that work's been going on. Understand and make sure we, you know, be able to address those things. So that happened as well, I think, maybe 2 weeks ago.
The Delaware County IT Director, Frank Bellotti, has assigned Lisa Rydell full-time to look at all of these different information systems and how they interact and how transitions can be made to transition each system when necessary. Because obviously, whether it's medical services or other services, they all interact with, not only with the prison information system, but with the county in different ways. So all of that has to be mapped out, and transition plans have to be developed for each of those.
And Majid, with the staffing numbers, is that knowledge that we have with the neighboring counties of what their staffing numbers are, so we can just compare of what they're going through and what's exacerbated by, you know, the COVID situation, and what the difference is compared? Do we have those numbers as well, like how we have ours that we could look at that as a board?
Yes, and Howard Lazarus and myself had visited both Montgomery County and Chester County, collected data from them on a number of different parameters of the jail operations, and we're planning a visit to Bucks County in the coming days. They've invited us to come and visit their prison and also to talk to them about their operations. So the local counties have been very, very helpful. And speaking to Bucks County, they said they interface on a regular basis with Montgomery County, comparing notes as to problems they're having within the prison, solutions they're bringing to the table. They're learning from each other. What works well in one place, they adopt in the other, and vice versa. And they said they've improved operations in Bucks County by working closely with Montgomery County. So something to think about down the road. If Delaware County takes over the prison, there are willing partners in the area that want to work with you to problem solve together and take on these challenges in a coordinated way.
Now, that makes sense to establish best practices. It's nice to, you know, collaborate with the neighboring counties of what's working for them and what's not working for them. So,
Right.
Good.
Yeah, and that's a collaboration that is reflected at every level with our neighbors in Chester County, Montgo, and Bucks. We actually speak with them weekly at a commissioner level, and we're doing so even more throughout the coronavirus pandemic. So good to have good neighbors. Any other questions or comments? Thank you, Mr. Alsayer.
Thank you.
Next item is subcommittee reports. Do we have anything else on our various subcommittees? All right. Mr. Tatum?
First, I'd like to correct the record on something I said earlier. I had a misstatement. Health Services did not significantly contribute to the increase this time. As I look at the other departments, in fact, they were the least of the issues when compared to Correctional Services and the Records Department, which had, looks like from last month, an almost 40% increase in the amount of money they're paying in penalties.
This is in records?
Yes, the Records Department. There's 9 people missing in the Records Department. 5 case managers, I think 2 records techs, and 2 other positions I can't call right now. But that was a misstatement. I just wanted to correct that one. And if I could add on to discussion regarding staffing. You know, we were talking about this a little bit prior to this meeting. You know, when I was in the Bureau of Prisons, I was at facilities where we were staffed as low as 75%. And we still ran a pretty effective operation. The people, you know, felt, you know, the people who were there felt a loyalty to each other, and they came to work, and so things, you know, operated a bit better. But I have to say that, you know, having been in corrections for almost 30 years, there is a component to corrections that is often overlooked, and it's not just money. Money helps, but money isn't the primary thing. I talked earlier about the environment that you work in and making it a great place to work, and looking at quality of life issues for staff. and looking at mental health issues for staff as well. It is very tough working in corrections. It's very tough to go into a prison day in, day out with people that you're managing who obviously don't want to be there. There are a number of issues surrounding this that you ignore at your own peril, and it will result in a lack of attendance, a lack of recruitment, a lack of job satisfaction, right? So it is beyond money. It is a problem that even before the pandemic existed, and it existed in a number of places in this country. And how you manage that will determine your success, you know. But it's not just money, and I just wanted to add that to that conversation. So, in terms of the Wardens Report for June, our current population, 1,437, increase. Total commitments in June are 604, and discharges of 569. We had a recidivism rate of 64% for the month of June. It's down 3% from the previous month. Significant incidents that occurred during June. The facility was locked down on Monday due to a disturbance, a minor disturbance on 7B. The issue was that they didn't have recreation for Sunday, you know, which was out of sorts. When we had just gotten back to normal recreation, it was a disappointment for them. And so as a result, they refused to lock in, right? There was a town hall meeting explaining the circumstances to the inmate population and their leaders, and it was resolved without further incident. That was the weekend of June 26th, where we had the staffing issues that went into June 28th. On June 19th, regretfully, we lost President. He passed away. Preliminary assessment appears to be because it was due to natural causes due to a seizure disorder. In terms of reduction in contraband efforts, I'm going to cover that now because that's been much made of that, and it is a focus for us at this point. And so these are just some of the things that we've done to try to turn the tide on that, so to speak. Cell searches total in June 8,648. We had K9 searches totaling 246. We had 9 shakedowns. Shakedowns are like a mass search where you have organized teams, and a lot of that is based on tips that we get, right? Or it could just be a routine function of finding a place in the institution that hadn't been searched yet. So we had 9 of those. We had a 17.64% drop in serious contraband from the previous month. We had 1 no-notice vehicle search, and I got caught up in that as well. So it's pretty much I would say 90% of the cars, much to everyone's chagrin, was searched that day, and we had some late people coming on to shift. Right? Which is interesting is that we had no cell phones retrieved since June 17th. That may not sound like a big deal, but we had quite a few cell phones found over the last couple months. Since we've gone to, we've installed an inmate tip line, which has led to a number of fines. And also, we've had improved search procedures at the entry point, where we have to now have 100% compliance with the metal detector. So, and that's also around the clock, not just 8 or 16 hours.
Who is being tested on that?
What's that?
Who's going through the metal detector?
Staff. CID assigned a detective as an investigative resource for George W. Hill specifically. And so we're working with that individual and a task force, as well as the prosecutor's office. We have monthly meetings regarding certain intelligence and investigations that we're involved in. So we find that these meetings have been productive, and look to it bearing fruit sometime in the near future. I'm going to go to visiting now. Visiting, you know, we started on June 28th. And to date, we've had 202 on-site visits scheduled. We still have video visitation going on, but that's been limited now from 9 a.m. to 11:30 a.m. and 12:30 p.m. is when on-site visitation begins. So that's our new schedule. To date, we've had 560, well, in June, that is, we have 560 video visits scheduled, and a total of 4,264 video visits completed to this point free of charge based on the pandemic. Also, GTL has assigned a project manager to coordinate and complete the process of allowing a video visitation for the Public Defender's Office. I know this has been something that they've been looking forward to. It looks like this may come to fruition probably sometime in August. I'd like to give recognition to Kelly Shaw, who's been all over this issue and really following through on it, so I appreciate her. In terms of behavioral health, that update, we had 3 persons on the wait list for Northtown Hospital. And the county drug and alcohol liaisons discharged 76 residents to inpatient treatment last month. That's a pretty big number. We have 26 participants in the Vivitrol program as of in June. 4 of them are females. We had 3 people discharged from the institution that were in the program during June. They were all unsentenced. Education programs. Contact teaching has increased based on the changing CDC guidelines. What this means to us really is that on the actual units, we've been using classrooms and cohorting per unit. Prior to the pandemic, we might have someone from another unit come to a classroom for, participation to another classroom on another unit. We don't allow that obviously now, but we have increased the number of people allowed in the classrooms, as long as they're from the same unit. So it's going pretty well. We had a total of 104 students enrolled in GED and or other educational programs in June. And in terms of education treatment programs, we had 157 inmates participating in June. There is a new program that was initiated July 1st by the Delaware County Women Against Rape organization. We have an LSW, Emily Greenwald, who's teaching a class there. She's going to be teaching at a minimum 2 8-week sessions. Right? And I look forward to reporting next month on the outcomes of that program. The maintenance update. The County Council on July 7th approved the replacement of the tray washing machine at the tune of $138,914.44. And the vendor will be Federal Supply. So we're looking forward to that happening soon. The issue now is we haven't been funded just yet to do the purchase order. HVAC continues to be a challenge. Unit 6B and 6C are now operating on temporary air. And that's probably going to go for the next 6 to 8 weeks until we get compressors in for that unit. But as of right now, the temporary seems to be working. And that's all I have to this point. If you have any questions,
Questions from the board?
I just have a comment, not so much a question, but with respect to the lockdown or the disturbance, I just wanted to also let people know that when there was a report of that, I was able to reach out to Sheriff Sanders almost immediately, who almost immediately was able to get real information on the ground with with the warden, and I really appreciated that. So, some of the synergy of this board really is helpful, that, he could reach out to his sheriffs and let us know that everything was okay, and that while there was some appearance and preparations, there was, you were able to do things without any disturbance, real disturbance there. It's bad enough for an appearance, but
right. There's no use of force necessary.
Not everyone knows what's going on. So anyway, thank you, Sheriff Sanders, and thank you, Warden, for letting us know what went on really in real time fashion.
Any other questions for the warden? I had a couple. I think just on the last topic about the HVAC issues at 6B and 6C, what does temporary air mean?
That means
Because
that-
obviously this is the time of year where we really need to be vigilant to make sure people don't
Right.
have dangerous situations.
So, I had to learn this. Each housing unit has two HVAC units, two AC. There's a Unit 1 and a Unit 2. In this particular housing unit, Unit 1, which controls pods B and C, the compressor went out. That's been a big issue for us of late. So that compressor, you know, because of the age of it, isn't easy to replace. And so now I think they're gonna have to fabricate it someplace. So that's what we're waiting on. The temporary air is just a big unit that has to be craned over the fence next to the building and then hooked up to the roof where the air conditioner is and piped down, right? Which is less efficient because now you have air coming from the
Or
ground.
just make sure you're speaking into the mic.
Okay, I'm sorry. The air coming from a unit on the ground traveling up and then back down again, as opposed to it starting at the top and then coming down, right? So it's not ideal, but it is something that we have in place until we get the item fixed.
Okay, but as far, you've checked the units that would be impacted and they are getting sufficient air under
Yes,
this?
we do daily temperature checks on all three units, right? This is something I started back in February because of the heating issues. And so we just continued all the way through now that we have, cooling issues, right? So all three shift commanders, each shift, they do temperature checks on all the blocks, right? And that gives us a real way of looking at, what the temperatures are and reacting to things before there's a complaint, right? So, the average temperatures on those units are probably in the mid-70s.
And is there anything else that needs to be done to mitigate the higher temperature? Is there water that's provided?
Well,
additional water?
We have stocked up on water and ice in the eventuality that, a unit goes out and it's gonna take a while. And so we have backup plans to put fans on those units where the air conditioning's gone out and provide ice and water. And of course, if we have open units that do work, we'll move, as a backup plan, we'll move the residents to that unit. The last time we asked, no one wanted to move. We had a couple takers, but for the most part, they just waited it out until we got the temporary air on 6.
Great. That's all for me, and I appreciate your addressing the contraband problems and what's being done there. All right, the next item is public comment. Anything further from the public? And as you're addressing, just make sure, name, address, and just make sure you're speaking into the mic so that the AV system will pick you up.
My name is Katie Guidati, 2428 Franklin Avenue, Seacane, 19018. Speaking today on healthcare, the most common reason for families to contact advocacy groups is inadequate healthcare, which is not a problem that is unique to Delaware County or even this state, but it's an area where the gap between policy and practice is very wide. We are asking that GEO eliminate the $5 copay, especially when it's a nurse for sick call. Copays do not really impact the cost of providing care. They primarily discourage the prisoners from accessing care. And better, quicker access to health care is the result we are asking for. It's imperative that staff are taking complaints seriously and not ignoring the call button activations. Prisoners should not be dismissed and sent back to units without a documented exam when possible and conclusions. And as we learned from COVID, many things can be a symptom, even headaches. Thank you.
Thank you, ma'am.
My name is Jamila, and my address is 6025 Spruce Street.
I'm
We
sorry,
have
ma'am, what's your full name?
Jamila Perry.
Noah Perry, thank you.
We have seen data that indicate that about 40% of the men and women in our jail suffer from some form of mental illness, even when GEO says their mental health roster is 0. In fact, the mental health care caseload is unmanageable. The number of suicides in recent years illustrates this horrifying aspect of GEO's management. There must be a more thorough intake screening to identify what amounts to nearly 40% of the population. The on-site presence of psychiatrists to prescribe medications must increase to near full-time, and there should be full-time psychiatric nurses. We must ensure that discipline is not used as a substitute for mental health care. Individuals who have mental health issues must be placed on a designated roster and then not be placed in the RHU for any reason. Save an immediate threat to the safety of others which cannot be otherwise mitigated. In other words, these men, women, and adolescents should never be in solitary confinement, a solitary confinement situation. There also must be close monitoring of inmates in solitary confinement for signs of decompensation. One key component to good physical and mental health is adequate physical recreation. Regular activity and exercise assist in weight control and reduce the risk for diabetes, cancer, and heart disease. They also lead to better sleep and appetite, as well as reduced mental stress. The facility must strive to incorporate outdoor time for every person in every housing unit for at least 1 hour every day. The practice of frequently locked down the facility must end. GEO relies heavily on this tactic to compensate for their inability to adequately staff the facility. Not only do lockdowns interfere with important services, but they also are detrimental to both physical and mental well-being. Every lockdown must be documented and reviewed by the Oversight Board as an extraordinary event. Thank you.
Thank you, ma'am.
Diane Simon, 4201 Somerset Lane, Upper Chichester, Pennsylvania. Proper personal hygiene is critical for good health. The lack of proper personal hygiene is a known contributor to disease spread. If one lesson has been learned from the COVID pandemic, it's the need for the best possible hygiene and sanitation practices. Reports from prisoners and families continue to describe unsanitary places throughout the facility. Every person is entitled to a clean shower every day, free from mold and standing water, and to appropriate shower shoes to prevent the spread of infections. Toilet access can never be denied. Inmates on their pods can never be locked out of their cells unless an alternative toilet is available. Inmates in intake and other holding areas must have access to a toilet at all times, not subject to an officer's availability or discretion. There is a steady stream of reports of broken pipes, heating and air conditioning failures, and even power failures. Critical infrastructure has degraded, causing these frequent and severe crises. There must be a thorough inspection and evaluation of every critical system. a plan for periodic maintenance, implementation of backup procedures, and the removal or refurbishing of every system or component which is beyond its expected useful life.
Thank you, ma'am. And just on that last point, I will make note that there is a conditions report that is in the process of being conducted as part of the transition effort.
Good afternoon. Susan Duncan, 317 Valley View Road, Media, Pennsylvania, Upper Providence, District 2. Drug and alcohol care. Addiction is not a simple, single problem. It permeates every facet of life and must be addressed as such. Phoenix report said that 21% of new arrivals go through detox upon admission. So the treatment program must continue to be medically supervised and medically assisted. But GEO Group is looking for excuses to keep expert treatment from closure out and pass up the grant money that would fund it. Under no circumstances should a new arrival be forced to endure cold turkey or other forms of withdrawal in an intake cell. Those who arrive must be thoroughly screened and then properly assisted by medical personnel. The treatment staff must coordinate and collaborate with other departments to develop and provide a holistic program, and the county should not pass up the wonderful opportunity to have drug and alcohol treatment overseen by an outside medical provider. Thank you.
Thank you, ma'am. And I will again note that today we passed an amendment that doubles the capacity for medication-assisted treatment. And that, as you are aware, we're RFPing for outsourcing of the medical services away from GEO.
Good afternoon. I'm Mary Austin, 1036 First Avenue, Upper Providence Township. We are a Delco Coalition for Prison Reform. We're not only here to make sure that the facilities in the prison are humane, but also that those in the prison are treated humanely, that they're not subjected to crowded cells, illness, and violence because of exhausted, frustrated, overworked, and underpaid staff, and limited services. I've heard one of the council members saying that they sleep better at night knowing deprivatization is forthcoming. We are not waiting until next April to have a good night's sleep. I implore you to put yourself for one moment in the shoes of the mothers, fathers, and relatives of those who are currently incarcerated, most who have not even been brought to trial, but are still being abused and hurt and treated inhumanely. They are taxpayers and voters, and they deserve better. And we will not stop showing up for them and their families until they get the care they deserve. Thank you.
Thank you, ma'am.
Good evening or afternoon. David Cleary, 72 Schoolhouse Lane, Glen Mills, or Concord Township. I live exactly, the end of my driveway to the prison entrance is a mile. I made that run a few times. And I come to you here today because there's always been problems with the prison guards cutting through on the street I live on and disrespecting the traffic laws. My son is a special needs student that also goes to school during the summer, and so he's in a program called Extended School Year. His new bus pickup time is a little later than what he's had in the past, so he hasn't really been exposed to the hazards of those folks cutting through. If I could quick digress, probably about 8 years ago when my son was on a bus schedule that matched up with the 2 shift changes at the prison, one day a neighbor girl was getting off her bus across the street. Or on the other side of the road, I should say. We don't allow that for our kids because we're afraid. In particular, the egregious acts have been prison guards. A prison guard was stopped behind her bus, decided to start pulling out and going around the bus while the girl was getting out on the other side. I started screaming bloody murder from the end of my driveway. The car stopped, maybe it was me, maybe it wasn't. We contacted the school district and said our kids are always getting picked up on the same side of the road. Actually, when extended school year started 2 weeks ago, the first day the bus driver tried to drop my son Michael off on the opposite side of the road, and we got that corrected quickly. Unfortunately, we got it corrected. Last week on July 8th at 08:13 in the morning, 2 prison guards were stacked. I would later find out that there was 2 prison guards stacked behind a car that stopped 100 feet away from the bus stop. Well clear. One of the cars got impatient and started pulling around the first car. I walked out in the road and stood in the way. The car kept coming at me, so I stepped aside. Clear as day, that person was right there in a prison guard uniform, and I could pick that person out. And it blasted through the red lights of the school bus and through a 4-way stop down the road. And that disgusting, disrespectful, egregious behavior to the safety of the kids in my neighborhood can't be tolerated. And so now when I go out there, I was out there today. My son's bus pickup time, we have to be out there at 8 o'clock. I always thought in the past it was shift change before the 8 o'clock hour, before the 1600 to 4 o'clock hour. It appears it's very problematic at or around and after 8 o'clock. 2 prison guards hurrying down the road after 8 o'clock to get to the prison. It really begs the question, how many guards are late for their shift every day and what's done about it? And I'm beside myself. The state police really aren't interested in addressing this. And as a regular citizen, you can't make complaints to the state police unless you have a political connection. They're going to ignore you. I would ask for help from the DA. I think he would be reasonable. In the past, we haven't had much success doing that. This has to stop. There has to be a solution besides people like me are supposed to be standing out there with a camera at the ready, trying to catch these egregious acts. One of the cars this morning, it was less than 2 feet from the bumper of the car in front of it, because the car in front of it, I guess, wasn't going fast enough. A couple of years ago, I was on a Sunday morning jog. I run on the opposite side of the road, a prison guard doing about 60 miles an hour on our street had to have blown through the 4-way stop about 100 yards back at least 30. Almost clipped me, and I didn't even see it coming because it was passing another car on the wrong side of the road. I shared it with the barracks commander at the time. He's like, whatever. They could care less. Somewhere there has to be a resolution to stop this. I'll be out there tomorrow morning, and now it seems like predictably the bus is going to be a little late. So I'll get to see a little bit more of what's coming through, and there's probably going to be 2 late prison guards hurrying down Schoolhouse Lane. And Sheriff Sanders, to your credit, I went to pick up some milk at about 7:20 this morning at the local Wawa. I was behind 3 county sheriff vans, and I was expecting them to make the right turn on Schoolhouse. They kept going and must have gone up Cheney to the prison. I hardly ever see cutting through, I guess, lately. And to be honest with you, my son's school bus time is usually 6:50 pickup, not the extended school year, 8:05. So we hadn't seen this until recently. It's bad. And I didn't know who Lee Tatum was tonight. I get these emails. This guy's got to be humble. He's getting back to me. But it doesn't have Warden. There's no signature. I looked at my mail here. And so I now know who this Tatum guy is who's getting back to me. He's actually the warden. I appreciate his response, but it frankly hasn't mitigated the concern or frustration.
Sir, is it always the same cars? Have you noticed it's the same cars every morning?
It's real recent because of the extended school year. I can't answer because I don't have enough data. And to be honest with you, I don't want to be put in a position where I have to be out there taking pictures. My son's special needs. I got to kind of spend that time with him and keep track of him and do things with him while he's waiting for his bus. I can help to some extent, but It's a problem. That car on July 8th, knowingly, even after I stepped out there, proceeded at me. And it wasn't somebody heads down Texan that just missed the red lights. That was some individual with total disregard to that safety feature that's supposed to protect kids at school bus stops. And I think the warden understands how disgusted and unfortunately, the worst abusers are people in prison guard uniforms. There's a little bit of a giveaway. I was in the Navy. You get a little bit branded because people say, it's a Navy guy that did it. But they are the worst. I don't think somebody in the neighborhood would blow through the red lights on a school bus like that. And I don't mean to take up all your time. I think the person that ran the red lights can be identified by the prison staff on July 8th still. There can't be that many people that late, and I can work with somebody offline on a description, and there has to be something. I'm repeating myself. Any other questions? I appreciate your question.
Thank you, sir, and I certainly sympathize with the predicament you're in. I wish the state police were doing something more for you. If they are prison guards, they're GO employees, and I ask the warden to continue to work with you to identify who they are. If it's a few who are really creating this issue, let's see if we can get to the bottom of it.
Your answer potentially be what I've seen recently. They're all late for work. If they're punching in on a clock,
Yep.
the people I'm seeing are late for work because I don't get out there till 8 o'clock. And if your shift changes at 08, and they're...
Well, let's work offline to see if we can identify who they are.
Warden, if you have a minute afterwards, I appreciate it.
Thank you, sir.
Yeah, thank you.
Good afternoon or good evening. I'm not sure what time it is. Mr. Chairman, members of the board, and distinguished guests.
Sir, your name and
My
address.
name is Michael Brown, 556 Hawarden Road, Springfield, PA 19064. I'm speaking for myself. I'm not representing any group. Is it a question of if, not when, this prison will be a public prison and not a private prison? Can you answer that question?
I'm one member of the board. You've seen that we've been going through a process over the past 8 months now to make that a decision for this board, but I don't want to presume the votes of my peers. It would be inappropriate for me to do so.
Can I go from left to right and just ask?
Sir, no, I'm sorry. It wouldn't be an appropriate interaction.
Not that, just a different question. Has anyone on the board been to the prison?
I think we've all been to the prison.
Have you talked to
multiple times.
prisoners?
Yes.
Okay. That's all.
Thank you, sir.
Then. Thank you.
I'd just like to say as one person on the board, I think that the board is taking all the steps necessary to make a decision on that. That is what's best for the county and the people that are operating the corrections officers, the residents, inmates of the prison, the people that are in our county. But I think all this work needed to be done. This board's not a very old board, but all this information needed to be done, and we need to know how to do, if that decision's made, we need to know how to do it right. And my view as controller is that we have to do it right, and to do that, we need to know what's going on and how it works and what we will need to do at the county to make that decision. And I sincerely believe we're doing everything we can as fast as we can to understand the situation and conditions up there. And I do appreciate the question. I think it's a relevant question, and I do appreciate everyone's advocacy and concern for the people there. But I just want you to know where I'm coming from.
Any other public comments? Great, any other further comments from members of the board? Hearing none, I would entertain a motion to adjourn.
Make the motion to adjourn.
Second.
All in favor?
Aye.
All right, thank you all.